Marijuana Use in the United States by Rupert Thompson. Marijuana, also termed as cannabis, weed, herb, or pot, is a drug that is derived from a cannabis sativa hemp plant. This plant contains the mind-altering chemical THC and CBD as the active compounds. Although the drug was initially illegal in the United States, its legalization for medical use and the adult recreation is increasing in several states in the country. This drug is normally used in the form of vaporizers, smoked in pipes, bongs, or hand-rolled cigarettes, ingested or mixed with food. Marijuana has a long history of human use in the United States. The initial use of the drug in some ancient cultures, such as Asia, was for medical purposes. In the United States, the cannabis cultivates can be dated back to the early colonists, where the plants were grown for rope and textiles. However, the political and racial factors led to its criminalization in the 20th century through the Marijuana Tax Act. The illicit use of the drug grew in the nations due to its stimulation effects. In 1970, the United States introduced the Controlled Substance Act, citing high potential for abuse and could not be accepted for medical use. Abuse of marijuana can lead to the addiction, which makes people dependent on the drug. The use of the drug has increased in the country, with an increased number of states legalizing its usage for recreational or medical purposes. Marijuana is one of the most commonly abused substances in the United States, according to Davis et al. 2024. Noted that 24 states, along with Washington, D.C. and Guam, have legalized recreational or medical use of cannabis. This has increased accessibility of the marijuana among Americans. Over the past year, 18.7% of people aged 12 and older had used marijuana. The drug is highly consumed by young adults aged between 18 and 25. The adults aged 26 and older have the second highest percentage of consumption at 17.7%, followed by adolescents aged 12 and 17 at 10.5% in the past year. 21.7% of high school students in the United States reported using marijuana in the past 30 days, which is the same trend as 10 years ago. In 2021, 13% of people aged 12 and older used marijuana in the past month. Americans, Indians, or Alaska Natives aged 12 and above are more likely to have used marijuana in the past month in 2021 at 27%, followed by multiracial people in 21 at 21.1%. The Asian people were the least ethnic group likely to use marijuana in the past month, with 5.4%. The drugs are commonly used among this population for recreational purposes as compared to medication for medical use. According to the age, young adults aged between 18 and 25 are the most vulnerable population related to abusing marijuana due to increased peer risk factors. According to race or ethnicity, American Indian or Alaskan are the highest risk of using marijuana. Consumption is also common among people from low socioeconomic groups. A family history of substance abuse increased the vulnerability of an individual's abuse to marijuana. People with a history of childhood abuse or a prior history of substance use are more likely to abuse marijuana. Lastly, people with mental health disorders and issues such as depression, stress, are more likely to abuse marijuana as compared to those without these conditions. Immediately after smoking marijuana, THC is passed into the bloodstream from the lungs, causing fast effects. However, the same effects can be felt for 30 minutes to 1 hour if the person eat or drink the drug, as THC absorbs slowly into the body. THC causes the feeling of high from acting on brain cell receptors. Other short-term effects of marijuana include altered sense of time, altered senses, change in mood, impaired body movement, impaired memory, and difficulty with thinking. When taken in high doses of high potency, it can result in delusions, hallucinations, and psychosis. Long-term effects of marijuana use includes respiratory issues, where regular marijuana smoking can result in lung damage or chronic bronchitis, and cardiovascular effects such as increased heart rate and blood pressure. Substance abuse can also result in mental health problems such as anxiety and depression, increased risk for psychosis disorders such as schizophrenia, and cognitive impairments such as memory problems and impaired cognitive functioning. Long use of marijuana can lead to cognitive impairments where some people develop memory and executive functioning issues. Cannabis use has long-term effects of addiction where the user becomes dependent on the drug, develops withdrawal symptoms, and continue to use despite understanding the negative consequences of the drug. Unfortunately, due to addiction and the negative impact of long-term use of marijuana on the body, it can result in impairment in one of the functioning, reduced life satisfaction, and related issues. Some of the physical signs that can suggest abuse of marijuana during assessment includes increased appetite, dry mouth, tachycardia, bloodshot eyes, poor coordination, and distinctive smells of marijuana. Behavioral signs include change in mood, decreased motivation, impaired judgment, altered perception, and increased anxiety and paranoia. Psychological signs can include trouble with concentrating and short-term memory loss. The patient can report increased irritability, difficulty sleeping, depressed mood, and physical discomfort as withdrawal signs. Marijuana is considered less harmful as compared to other drugs due to its low potential to result in fatal overdose. However, large amounts of high-potency marijuana can result in severe physical and psychological symptoms that may demand medical attention. Marijuana overdosing can result in severe anxiety, panic attacks, psychosis, high blood pressure, severe drowsiness, extreme nausea, and impaired motor skills. Overdose effects of marijuana are more likely to occur in new users as they have no or little tolerance to THC. Although people with pre-existing mental issues and polydrug use increase risk of negative impact of marijuana use and overdose. A care plan for a patient struggling with marijuana addiction should include the integration of pharmacological and non-pharmacological treatments, patient education, referral, and follow-up plans. These different sections of care plan will be discussed in the following slides. To date, there is no FDA-approved medical drug for the treatment of cannabis use disorder. However, the following medications can be used to manage the presented symptoms by the patient of cannabis use disorder. Gabapentin 300 milligrams 3 times daily for reduced anxiety, improved sleep, and executive functioning, which are associated with withdrawal symptoms. Prozac 20 milligrams, 1 cap by mouth, every morning should be prescribed to help manage withdrawals and avoid relapse. Taking BoostBar 7.5 milligrams twice a day by mouth can help reduce anxiety symptoms associated with marijuana use. The patient should be exposed to cognitive behavioral therapy and address the negative thoughts and develop coping strategies with withdrawal symptoms. CBT will enhance the motivation for change, helping the patient work towards achieving and maintaining sobriety. The CBT session should also include some sessions for motivational enhancement theory, which will enhance the motivation for change, resolving ambivalence on quitting and the use of the drug. The patient should also engage in more physical activities and change friends to reduce time in situations that trigger them to desire using the drug. The patient should be educated on the long-term and short-term effects of marijuana on physical and mental health. They should also be educated on coping strategies that can help them manage cravings and stress without resorting to using marijuana. This includes helping them identify triggers and come up with a plan to manage or avoid them. They should be taught that the advantages of adopting a healthy lifestyle with an increased exercise, a balanced diet, and adequate sleep. Lastly, the patient should be educated on the importance of prescribed drugs and possible side effects. Referral. The patient should be referred to outpatient marijuana rehab for addiction specialists and mental health professionals to complete further assessment and individualized treatment plan. They should also be referred to a support group for peer support during the recovery. The patient should have a regular checkup by having 2 weeks of the follow-up appointments to monitor their progress and make any necessary adjustments in the treatment plan. The healthcare practitioner should maintain contact with the patient for easy identification and relapse and ensure patient adherence to the treatment plan. To sum up, marijuana is a widely used substance for both medical and recreational purpose. Substance use is common among young adults and increased risk of causing addiction. Risk factors for developing marijuana use disorder include young adults, people with family or individual substance use disorder, or lower socioeconomic status. Treatment of marijuana use disorder should be integrated into both pharmacological and non-pharmacological treatment plans that aim at addressing the effects resulting from the disorder. Thank you for listening to my presentation.